Thank you, Paul. It's wonderful to be here. This has to be one of the most challenging plenaries to give, though, let's face it. So I'm going to look at the definitions of the policies, which is really important. Look at some of the impacts from the available data, explore the pros and cons of the policies, and think about where we need to go now. I want to start with this, that I'm going to be covering a number of ethical principles, but not explicitly. But those principles underpin what we think about when we think about ethically sustainable vaccination programs. And also I want us to anchor to this point here with the image of the children, that what we're on about with vaccination is the health and well-being of children, families and communities, and human flourishing. And our policy considerations need to bear that ultimate goal in mind. So the simple definition, no jab, no pay, relates to the federal rules affecting family assistance payments. No jab, no play relates to state and territory rules affecting enrolment in childcare, preschool and kinder, and it's only in place really fully in a couple of states, as you'll see at the moment, but other states and territories are considering it. This is where Australia sits now in the spectrum of different requirements for vaccination. So if you like, mandates. People say mandates, they mean different things. So at the right end of the spectrum, right now in Australia, we have a requirement with no personal belief exemption or conscientious objector exemption. We have other exemptions like medical exemptions and a few other smaller ones. Uganda has the same. Their consequence is jail. Slovenia has a fine, and California now has a restriction on school entry. Previously, California had the one where Arizona is, which was an easy personal belief exemption, an easy to acquire one. But then you've got requirements with strict personal belief exemptions, such as Washington State, Ontario in Canada, and Australia between 1998 and 2016. Apologies, that's an error. And the UK that doesn't have any requirement. So and this is just a sample of countries, this is not a complete list. So that's where we sit on that spectrum at the moment. The timeline for federal requirements. So as I said, we had in 1998 this linkage of full vaccination to the receipt of family assistance payments, different payments at the time, including the maternity allowance, which had been in place since 1912. And so now we had the receipt of the maternity allowance linked to immunisation, and it was called the maternity immunisation allowance. So the point there is that these payments have been in place to support families for many years in different forms, and in 98 they were linked to vaccination. So in a sense, we kind of had a no jab, no pay then. The difference was that we had exemptions that including a conscientious objector exemptions, which included a religious exemption. Then in 2012, those incentives were broadened to have what we essentially have now, which was a linkage to Family Tax Benefit Part A supplement, the childcare benefit and the childcare rebate, and two of those were income tested. So they applied more to lower income families. And the maximum potential penalty, or the receipt of payments per year, could be up to $15,000. So no jab, no pay came along in 2016. It was applied every single year from age 1 to 19, and that's a really important point of distinction. Prior to that, it was applied, the penalty was assessed and applied at ages 1, 2 and 5. Now it was applied every single year until 19, which could be accounting for a lot of the catch-up we're seeing. The other change was that they removed the conscientious objection exemption, and they made the medical exemption much more narrow and strict, and when it was introduced, only GPs could sign it. Now paediatricians can. And there are a few other exemptions, like being in a vaccine trial, which is good for us in vaccination research too. The by July this year, those payments will change slightly, so the penalty will be felt every fortnight instead of at the end of the financial year. So, in summary, No Jab, No Pay is a reworking of a 17-year-old policy. It has 4 components: removal of objector exemptions, extending the penalty beyond 5 years, more frequent existing requirements, and narrowed medical exemptions. So when we talk about this policy, let's be careful not to lump it into one thing, and let's make sure that other countries looking at what we've done understand the different components of the policy. It's important in terms of how we look at impact, and maybe where some of our debates sort of lie in this. How did we get to No Jab, No Pay? Well, we had sudden national awareness of differences in regional vaccination rates in 2013 with the release of the National Health Performance Authority report. And immediately the problem was framed as an objector problem. And the script was written, certainly with the Sunday Telegraph, a Sydney tabloid newspaper. They immediately leapt into a campaign which they called No Jab, No Play. So that's where the name of the policy comes from. And they were calling for state governments to amend their legislation and the federal government to get rid of the loophole, which was the granting of conscientious objection exemption. The media frequently framed our vaccination rates as declining. Tony Abbott in May 2013 said they were even plummeting, or was quoted as saying so. And you even had very strident comments about parents who don't vaccinate being anti-vaxxers and baby killers. And this painting of the stereotype of the sort of irresponsible, selfish hippie. Post the announcement period, so this is the announcement, and Tony Abbott said that parents who vaccinate their children should have confidence that they can take their children to childcare without the fear that their children will be at risk of catching a disease. There were 508 million projected savings in the budget, presumably from the government's prediction that many people would not be able to get their payments because they would not comply. So that was quite a telling aspect of the announcements after the policy announcement. And then it started to get really political. Pauline Hanson weighed in. People strongly reacted to her anti-vaccination viewpoint, and the Prime Minister weighed in with a commitment to encourage COAG to support No Jab, No Play, the state-based initiative. And even a libertarian politician, David Lamhelm, said that he supported No Jab, No Pay and Play. We've been told the policy is working in a number of different areas, including the New York Times. So let's look at what working means. But before we do that, I want to look at what the evidence says improves vaccination coverage. So systematic reviews tell us that at the community level, reminder and recall systems work. Education works, but only when it's used in combination with other interventions, interestingly. Home visits work, as we heard yesterday. At the organisational level, at the provider level, provider support, assessment, feedback, recommendation to have a vaccine, standing orders, school childcare-based delivery and combined interventions. Similarly, at the community level, it's only going to work if you've got a multifactorial intervention. And at the public policy requirements for school and childcare entry, this is based on US data, work. Right? So requirements work in improving vaccination rates. Incentives do as well, and reducing, of course, cost of the vaccine. So let's look at the impact over time in perspective. So this graph takes you from 2005 to March this year and looks at the 3 different age groups for under 5s and shows that our vaccination rates nationally were not declining. Yes, they were lower in some regions, but in fact they had been improving in the under the 5-year-old age group. and that the change since 2016, January, when No Jab, No Pay was introduced, and those figures are for December of that year, so that's why it's closer to 2015, show a 1.77% absolute increase for children at 12 months and a 1.64% increase for children at 5 years. We're not looking at 2 years because of that algorithm change. Let's stretch out that y-axis and look at the different states and territories, all following a similar pattern, and each of them having different interventions to improve vaccination rates. And the point here is that there wasn't one thing that was going to be the cause of our improved vaccination rates, which were themselves relative to before marginal, but encouraging when you look at the numbers. So state-based initiatives, efforts to phone parents who weren't up to date, all the things that you do in your day jobs that's so important to maintaining high coverage are the kinds of things that were making a difference, and you were supported more by the political will and impetus around vaccination. Also, the federal government, the health department announced free catch-up for the over 10s, incentives for providers to catch children up, and campaigns. So there are a few things happening. Let's look at the gap. When No Jab, No Pay was introduced, we had 92.6% of children under 5 fully vaccinated, and the group in yellow are the registered objectors at the time, 1.52%, and the rest were not up to date but not registered objectors. We could assume that because of recording error, that actually you could possibly add another 2 to 2.8% onto that figure. That's based on various audits and more recent work in New South Wales. So we know that, you know, some kids were vaccinated, but it was the ASA wasn't up to date. So let's stretch out that 5.88 and 1.52% and look at what's happened. So the government has told us that for the children under 5, about 100,000 have taken action on vaccination since No Jab, No Pay. And taken action means received all the vaccines or commenced and partway through a catch-up schedule or received an exemption, probably a medical one. And then this group, we don't know how they've changed except a ministerial press release in July 2016, so nearly 2 years ago, which said that 5,738 of the approximately 30,000 children who were affected by an objection had caught up, had immunised. So we need this data to look at the effect on objectors relative to the effect on others who are simply prompted to catch up because of the increasing frequency of the penalty. This is data from Brindley Hull at NCERS. He presented this yesterday, showing an impressive catch-up for the MMR2 vaccine. I'll just point to the this group here, the 71,502, are the children aged 10 to 20 years who had an MMR2 vaccine subsequent to the policy. So certainly that represented 17.6% of that age group, but it represents a lot of children catching up for MMR, which is what we certainly want in terms of preventing outbreaks. What about the effect on exemption clusters? They've been a big focus in the media. We've been able to look at coverage for the 2 regions on the north coast of New South Wales that have had really low coverage. So this is from the North Coast region, and the green line is the 2 LHDs that started off with quite low coverage, the Bellingen and Byron Shire, which was certainly the feature of a lot of public attention, the Byron Shire and Mullumbimby. And this shows that it doesn't appear to have been much impact from any of this on their vaccination rates. They're still hovering around 70 to 75%. but there has been an improvement in coverage for the middle and higher coverage regions. So, you know, all of these things are giving us little hints as to where the impacts might be with this multi-component policy. No Jab, No Play is in place in 2 states, and I'll show you that with this. There's quite a lot of complexity around the state-based policies. I've tried to summarise it here. Since at least 94, there have been varied requirements for producing a recorded enrolment in childcare, sometimes school, enabling exclusion during an outbreak. And you either had to request a record or you possibly could request one. And then the legislation in New South Wales was tightened in 2014. But No Jab, No Play came into effect in Victoria in 2016 with the no conscientious objection exemption, meaning those children, if the parents didn't change, would not access childcare. Queensland had exclusions at the discretion of the provider, and New South Wales had No Jab, No Play for preschool, and that again, like Victoria, removed the exemption for conscientious objectors. So you can see that, you know, there's more attention to this. The states are starting to follow each other, and I'd say we're very likely to see other states follow suit unless they can, you know, carefully take a deep breath and consider the evidence and what certainly the parts of the paediatric and immunisation community are cautioning them about with this particular policy. The VPD risk in childcare, which you saw was part of the promise of the policy, well, we know about the dynamics of pertussis. The transmission can be in the vaccinated. Up to 50% of infants are hospitalised with pertussis contracted it from a parent or sibling, and maternal immunisation has therefore been highly effective. Measles, we're in a stage of elimination, so we don't see much measles except for outbreaks from imported cases, and then the spread mostly in the under ones or adolescents, hence the good catch-up that we saw with the MMR2. And outbreaks spread mostly in densely populated areas with large numbers of under-vaccinated. So they might not have low vaccination rates, but they have a lot of kids because they've got a large numerator. And that's certainly where a large outbreak of measles was happening in New South Wales in 2012. There have been concerns about early childhood education, as I've mentioned, so the National Partnership Agreement continues to commit to universal access to quality early childhood education programs for all children. So these policies contravene that partnership agreement between the states and the Commonwealth. The childcare sector has also expressed concerns there about having to implement this kind of rule. So what about the different impacts? I'm just going to quickly go through a handful of families to show you how different people have been affected by this, for better or worse. So you'll have the family who are reminded, they see all the publicity in the media about No Jab, No Pay, they're reminded and they catch up. You have the family who may have children born overseas, they need to catch up. They don't quite do so in time, the arrangements are so complex, the GP finds it difficult to sort it all out. When they caught up, they miss the deadline for payments and they lose them. The catch-up of MMR2 or other vaccines among adolescents. The people who are in this exemption limbo, where they support vaccination, but they, for some reason, have a fear of vaccination for their particular child, that, you know, in some ways it wouldn't be evidence-based, but it would make sense given their individual circumstances. Or the children who are medically complex, and I hope someone will speak to this later, but this is where a child may have to have sedation for catch-up vaccines, and the parents, or even a general anaesthetic, and the parents aren't willing to go there, so they're going to lose family assistance payments. Then for objectors, you've got the people who reluctantly catch up, and you've all encountered those people. and the people who hold their ground and adapt. And we've described that particular group in the paper by Catherine Helps that you see there. When asked in a recent survey by Paul Corbett on the North Coast, 16.4% said access to government family support payments is important in their decisions. So just to sort of bring all this together, the upsides of no jab, no pay and play are that the coverage increase is there at 1.6% amidst other strategies. There's catch up from expansion of the requirement, from the requirement finishing at 5, now it goes every year until the child's 20. The catch up from some objectors, the raised awareness of the existing requirements which were in place, the savings of 508, of which Susan Lee was able to bring 26 million to the Health Department to support good evidence-based policies, the responding to public demand and concern that in a democracy is what we do, the perception that you'll have more safety when the world feels less safe, I think is something that is definitely there as well. The fact that Victoria and New South Wales did put in provisions in their legislation for disadvantaged families, extra grace, catch-up grace periods and so forth. It obliges governments to enact other efforts to improve coverage, and of course we have had improvements in AIR. The downsides are that there is this differential effect on lower income families because of those means-tested payments with the federal rules. Consent becomes more coerced for lower income families because of that. Politicians will say it's not mandatory, you can choose not to vaccinate. For some parents, losing that amount of money does pretty well make it mandatory. And unless you're living in those circumstances, it's hard to imagine that. Objectors who won't change with no jab, no play, their children will be removed access to preschool education, which is detrimental, particularly in disadvantaged families. Informal childcare arrangements, the impact on the relationship with the provider and the health service, which continues to need to work with the families. Inadequate provisions for the medically complex cases and others not up to date, such as the are disadvantaged more often than they were before. And there's, of course, the consequence for recording error, which now falls to the parent. So what now? I don't think the federal policy isn't going to change. I don't see getting conscientious objection back again. It would look like government was stepping back from immunisation. So realistically, we've got to work with where we are now and advocate for a few things. First of all, we want the Department of Social Services to make their process evaluation publicly available. We want the federal government to conduct an impact and outcome evaluation. The responsibility starts with the Department of Social Services because this is their policy, but they would need to cooperate with health and possibly education and the Department of Human Services. Addressing the remaining gaps in child and adult coverage, continuing to improve AIR recording, possibly the revision of medical exemption provisions to allow an expert to assess atypical cases. And state governments and other countries should carefully weigh the potential benefits against known risks of removing early childhood education. So, and most importantly, the last point there was no-fault vaccine injury compensation. Australia doesn't have a scheme, it's beholden on us to put one in, as Julia mentioned yesterday. And with this level of requirement, we even more now should have a scheme to look after the very few who may be injured by a vaccine and who need compensation. So here's the conclusion. Is the juice worth the squeeze? Or is the squeeze worth the juice, Paul? Vaccination requirements in legislation and implementation and an accurate register and minimising the other barriers, and my belief is strict exemption for objectors, perhaps a yearly exemption, will get most of the juice. Removing objector exemptions from the above gives you a little extra juice, although we need more data on this, for lots of extra squeeze. I'll leave you with a suspension bridge. Suspension bridges are good because they're really strong, and they're strong because they've got a little bit of flexibility in there that allows them to sort of move in the wind. And I think that's quite a nice analogy for policies in vaccination. We want them to be strong and robust, but have a little bit of flexibility in there as well. Thank you.